pulse. So collecting blood sample is a frequently used method to diagnose and monitor diseases. Moreover, there are two types of blood samples, the venous blood and the capillary blood. The veins are the most conventional site used for blood collection, and the process of drawing blood from a vein is known as a venipuncture. Historically, arm veins are the best sources of blood, in which the preferred site is articubital fossa, that is where the arm bends at the elbow. The favorite is the median cubital vein. Other veins which can be used are the cephalic and basilic. In standard circumstances, it may be necessary to use hand or wrist vein when a suitable vein cannot be detected from the arm region. Most commonly in obese patients, or if there is a bandage or on patient hand or the arm have been punctured repeatedly. As for the requirements which are needed for the collection of the blood sample, we need the vecutaneous, we need the test tubes, and related to the type of sample, like the one which with that is anticoagulant, and the ones without anticoagulants, like the EDTA vial, like the sodium tricitrate, like the heparin vial. So we need the collecting vial, tourniquet, isopropyl alcohol, and sterile cotton. As for the procedure, the venipuncture procedure, first you have to ask the patient to make a loose paste and select the appropriate vein for that is for the puncture or for the venipuncture. Apply the tourniquet 3 to 4 inches above the collection site. Clean the puncture site by making a smooth circular pass over at the side with a 70% alcohol, cotton or fat, moving in an outward spiral from the zone of penetration. Uncurve the needle with the bevel pointing upwards. Pull the skin tight with your thumb or index finger just below the puncture site, holding the needle in line with vein. Use a quick, small thrust to penetrate the skin and enter the vein in one smooth motion. Holding the needle hub securely, insert the first vecutainer tube into the tube connector. Blood should flow into the vacuum tube. After blood starts to flow, release the tourniquet and ask the patient to open his or her hand. Once the tube is full, use one hand to stabilize the needle in the vein and remove the tube with the other. Inside other tubes in the correct order until all test samples are obtained. Place a gauze pad over the puncture site and remove the needle. Immediately apply slight pressure. Slight pressure, and then apply a fresh bandage over the penetrating site. As for the capillary blood is used for infants under 1 year of age and when it is not possible to obtain venous blood. Common site for drawing capillary blood are the heel and the ball and the ball of the middle finger. Skin puncture is carried out with a needle or lancet. In adults and older children, blood can be obtained from a finger. The recommended site is the distal digit of the third or fourth finger on its palmar surface, about 3 to 5 mm lateral from the nail bed. Formerly, the earlobe was commonly used, but it is not longer used, or it is no longer recommended because a reduced blood flow renders it unrepresentative of the circulating blood in infants. Satisfactory samples can be obtained by a deep puncture of the planar surface of the heel, most especially in the area because the heel should be very warm. It may be necessary to bath the heel. It is not necessary to bath it in hot water. Capillary blood is free-flowing and thus it causes a greater risk of contamination and disease transmission. Venous blood is therefore more convenient for handling and it yields considerably more accurate result. As for the requirement for the capillary sample collection, capillary blood collection procedure: clean the area with 70% alcohol and allow it to dry. Puncture the skin to a depth of 2 to 3 mm with a sterile lancet. Wipe away the first drop of blood with dry sterile gauze. Collect the second and following drops onto a reagent strip or by a 10 ml or 20 ml micropipette. So I think that's the point to highlight based on the blood sample collection related to the venipuncture and the capillary method. Thank you.